The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. This is Mickey Anderson. I hope that you are doing well this morning or afternoon, depending on where you're at. So I am standing in for Leanne today. Leanne, unfortunately, is feeling rather under the weather, so she's at the doctor right now, and is sorry to miss this webinar for everyone, but instead of having her strain her voice anymore because she has a sore throat, I am happy to step in and introduce everyone to the quarterly webinar that we will be doing today. I'm also here with Kayla Byard, Cohort 3 Fellow and Chapin Hall staff member, to assist with this as well. Okay, so today, and also Deb is in the process of moving right now to Denver, so she apologizes as well for not being here, but she is excited for all the presentations that will be coming up soon. Okay, so we wanted to gather everyone for this webinar because we know that fellows of all cohorts are doing all sorts of creative things with research and policy dissemination, and so we wanted to highlight a couple examples that have come through recently. And we also want to do this because within the past year or so, we've been creating these tip sheets that are produced by collaboration with fellows from different cohorts, and we would love to do one on dissemination strategies. So this is kind of a way to kick this off, and if you all could kind of keep your brains moving on other ideas of ways to disseminate and to add to the tip sheet, that would be great. So I'll be following up with that later on as well. Okay, so let's just dive right in, and we're going to start with our first presenter. And these are our presenters today. So we're starting with Leah Cheatham. She's a Cohort 4 Fellow at the University of Alabama. And so Leah is in her 4th year as an assistant professor at the University of Alabama School of Social Work. Her research focuses on transitions to adulthood among vulnerable youth, including youth with disabilities and youth who have been in foster care. Okay, so Leah, you can go ahead and take it away.
Thank you so much, Mickey. Well, I'll go ahead and move to the next slide since you so kindly introduced me. So I'm going to speak just a little bit today about my experience writing an op-ed recently, back in the spring. I think it's so wonderful that the fellowship makes these types of conversations a priority. I know during my time in the fellowship, we always had a lot of conversation around interesting ways to reach different audiences and disseminate our research creatively. So I think writing an op-ed fits right in with that type of thought process and trying to reach different audiences. Certainly you can reach a much broader audience in writing an op-ed than in presenting at a research conference or writing a scholarly publication. And it's also a great opportunity to think more about translating your research findings into practical recommendations. While, of course, we do that routinely in an academic sense, I have to share that my experience with this was I felt much more pressure to make my recommendations very actionable and tangible and approachable to lots of different audiences. So that was a really great opportunity within this experience. And of course, it's a great way to try to connect with some interesting individuals who are also doing similar work or interested in the same topic. So there are a lot of reasons to engage in this type of research dissemination. I'll talk a little bit about my experience doing that. Next slide, please, Mickey. So in terms of the writing process itself and how this opportunity came to be, I did not seek this out. I was just kind of out of the blue approached by an editor of an online publication called Youth Today, and asked to contribute an op-ed. They were running a specific series about foster youth and their experiences and challenges in higher education. And given the research that I do fits pretty well within that realm, I saw it as a great opportunity to speak specifically to the experiences of youth with disabilities who have exited the foster care system and who are pursuing higher education. And there's a great overlap in those populations and a lot of similarities in the challenges that those separate populations face in higher ed as well, youth with disabilities and youth aging out of foster care. So I certainly wanted to do this, and while I knew I was going to say yes, I will share with you, I was really nervous about saying yes because I have no idea how to write an op-ed. Nevertheless, I did say yes because of all the training that the fellowship provides us, and certainly the importance that the fellowship instills in us in terms of reaching all these different audiences. So it was a great opportunity in that perspective. I have included here on the slide just some of the audience that this publication tries to reach, including youth service professionals, policymakers, advocates, academics, educators, funders, and practitioners. So certainly a good opportunity for me to try to get some of my research and my priorities about that research out to some different audiences. So after saying yes, I'll go ahead and move on to the next slide and give some of my reflections about the process here. It was way more challenging than even I anticipated. I think maybe for a lot of us who are, more research oriented, there's a comfort in writing with objectivity, and there's a distance from the writing that you gain as a researcher writing for a scholarly publication or conference presentations, whatever it is. I had to try to get past that distance from the writing and learn how to be a bit closer to it and infuse my personal opinions into the writing, in providing personal experiences and anecdotes. It was just antithetical to everything I've ever done in terms of writing professionally. So that was a huge challenge for me. And with that, trying to think about infusing my own opinions, I kind of brought up some of those issues around imposter syndrome. I don't know if any of the rest of you struggle with this, but I certainly have during my time in academia. And then again, in writing this, who am I to provide my quote unquote expert opinion about, what foster youth with disabilities need in higher ed? But I tried to remind myself, we do this research for a reason so that we can be an advocate for these populations and try to advance the work in this way. So I tried to get over it. I moved forward. Another challenge that I found in sharing more personal stories was that certainly I was sharing from the perspective of an assistant professor at the University of Alabama. And some of my recommendations about what we as higher ed educators can be doing, sometimes I felt as if it was potentially going to reflect poorly on maybe my opinion of my university, that they would think I'm speaking specifically about what this university is doing as opposed to higher education at large. So that was a bit of a struggle as well. But ultimately, I think I tried to just frame things in positive ways so that we could, focus on actionable positive things. One thing I wanted to quickly mention, for those of you who might engage in this opportunity to write an op-ed, I kind of made the assumption that I was going to partner with the editor and kind of send drafts back and forth in an iterative process like we do in journal writing, where you get critiques and, opportunities for revisions, et cetera. So I sent in the first draft, and the next thing I heard was from some colleagues around the university saying, "Hey, great piece in Youth Today." And I was so shocked that they just accepted it as is. And in all of my rush to provide the draft, I never provided a title to the editor. So the editor provided their own title, and they may have done this regardless, I'm not sure. Nevertheless, keep in mind, whatever you send in could be, exactly what is run without any opportunity for further revision. So just wanted to mention that. I think, I did get some broader reach than I'm used to getting with scholarly journal articles. Some of the staff members here at the university in my school were contacting me saying they read this because they subscribed to this newsletter. So that was encouraging to me to know. And also just the process of engaging in this type of different writing really re-energized my passion for this type of work. In the fourth year, you hopefully you guys aren't there yet in terms of feeling bogged down in minutia of day-to-day operations, but sometimes you can kind of feel that way. So this is a great reminder of why I, took this type of job and why I do this research, and certainly inspired me to want to keep going with this. If I can move to the next slide, please, Nikki. And thinking about, opportunities like this in the future, if anyone's interested in doing this, I wanted to mention some of the resources I used in trying to write in this different way. I took advantage of the fact we have media offices here in the School of Social Work and the university. So I had a contact there I could send drafts to, and they provide me revisions to try to shift this to a more journalistic style. I also enlisted the help of the Writing Center at the university because I'm constantly referring my students there. I thought it was a great opportunity for me to try out their services myself and learn what kind of feedback you get. And I actually got a lot of helpful suggestions about infusing more personal opinion and sharing some anecdotes where I could. And that was very useful and a positive interaction. And also, I think colleagues, family, and friends can be great resources because you're really trying to reach a general audience with these types of publications. So trying to just get this in front of as many people as you can and get their impressions, that was really useful for me. And that's all I have. So I'll move on to the question slide. If anyone has any questions now or anytime in the future, if one of these opportunities comes up or you seek them out, I would love to try to help in any way I can.
Great, thank you so much, Leah. Yeah, if anybody has any questions, I forgot to mention this up front, but feel free to type them into the question box on the side of your screen where the GoToWebinar information is. And you can do so now, or you can do so at the end as well. We'll open up some time for question and answer for everyone. But yes, again, thank you, Leah, for walking us through that. And here's her contact information, which again, we'll show at the end if you have any questions.
Thanks, Nikki.
Okay, great, fantastic. So we're going to move on to the next presenter, and I'm going to introduce Stephanie Gusler. She's a Cohort 8 Fellow. She's currently a doctoral candidate at the University of Kansas Clinical Child Psychology Program. Her primary research and clinical interests are on the intergenerational transmission and continuity of childhood trauma. Okay, great. So Stephanie, if you want to take it away.
Yeah, absolutely. Thanks, Nikki. So I'm going to be talking about a dissemination plan that I'm currently working on with my policy mentor, and it's disseminating results that we've gathered at a psychiatric inpatient unit through a nursing staff lunch and learn training opportunity. So Nikki, if you can go to the next slide, please. So I'm just going to try to go quickly through some background on this project. It really started through my clinical practicum that I was doing at this inpatient unit. So just some information on the unit. It's an 18-bed unit where the kids are there an average of 2 to 5 days, so very acute care, focused on just crisis stabilization. The kids there vary a lot in age, ranging from 4 to 17. And while I was working there, I became really interested in how the unit was capturing the kids' trauma exposure, just anecdotally seeing that so many of the kids did have a lot of trauma exposure and a pretty vast trauma history. So I found out that they did have an existing trauma screening measure, just screening for events that the kids had been exposed to. However, I found that this was pretty limited in that it wasn't really based on any empirically supported measure. And the nursing staff were gathering this trauma screening tool. They were asking it of the kids, and then no one was really sure what to do with it after that. And then I also found that they didn't have any systematic screening for trauma symptoms on the unit. So in meeting with the administrative staff as well as my clinical supervisor, I found that they were open to seeing if there were ways to potentially improve this process. So I brought this to my policy practice mentor, Dr. Godinho, and he had previous research experience integrating more trauma-informed care at Bellevue Psychiatric Hospital. So he's been really integral helping me navigate this process and with the project and as we're moving into dissemination. If I can go to the next slide. So this next slide, just briefly, this is what their existing trauma screening tool looked like. And it's definitely convoluted. It has things mixed in here, such as substance use, if the child or adolescent is sexually active or not. So initially looking at this, I was kind of envisioning a total overhaul of the measure. However, meeting with the administration and other staff, they were insistent on keeping this measure as is, but were open to the addition of new items, new potential events that they weren't asking the kids about, and seeing if that made a difference and seeing, what information this was giving us. So that was kind of the compromise we made. So on the next slide, I have just an example. We can go to that. Thanks, Vicki. These are examples of kind of where we landed on adding 6 new events that was based on other empirically supported measures that wasn't being captured by their existing screening tools. So we added these 6 new items as well as just an open-ended question that the kids could answer about if there was anything else that had happened to them that they wanted to let us know about. So that's kind of where we ended with things. And if I can go to the next slide, for the trauma symptoms, this one was difficult to add into the intake process. So there was some difficulties figuring out where this fit in since this was completely new. They didn't have any current screening tool for this. So the solution that we came up with this is adding this short 10-item screener to a therapeutic group. So in this group, having all the kids fill out this screener and then having the group focus on coping skills for those trauma symptoms so that we were able to capture that information, get the data, and also address those symptoms and how they may be able to cope with those symptoms within the group. And then in the next slide, I have just some main takeaways of our results. I'm not going to go into all of that, so I can talk more about the dissemination piece. But just briefly for trauma exposure, we did find that there was a really high prevalence of trauma exposure on the unit, and those prevalence rates there are of the new items, so really high prevalence of experiencing those additional items we added to the screener. And then finding that 53% of the trauma exposure that the kids were reporting was not being captured with their previously used measure. So 53% of the total trauma exposure for these kids was being captured by the additional items that we added. For trauma symptoms, this so far has only been done with a subset of the kids. So total data for trauma exposure, we have about 150 kids. For trauma symptoms, we've only gotten about 40 kids data. But this is just providing some information on the high prevalence of trauma symptoms there for the kids as well. And then we found that total trauma exposure is associated with longer stays on the unit as well as more trauma symptoms. So if I can go to the next slide, I can talk about our plans for dissemination. So we plan on doing this in a couple of different stages. Our first step is to disseminate these results to nursing staff. And we decided to start with nursing staff because they're the ones that are implementing or asking the trauma exposure screening questions. So they're really the ones that have been integral in getting us this data so far. And we've also met with a subset of a couple of nurses who've been integral in providing their input on items that they felt like should be added, as well as sharing their experiences of this. So we found out about an opportunity that is available at the organization where they occasionally do things called lunch and learns, where the organization provides lunch sort of as an incentive for staff to attend an hour to 2 hour training. So in talking with my subset of nurses, they told me that it would be helpful to not just hear the results, but also to know what they can do with the results. So there was an interest in being more trauma informed in how they approached these kids, but not really knowing what that looked like. And in general, not having a lot of information on behavioral management techniques that they could do. So we have created a presentation that integrates the results, so sharing the results of the screener with them, and then moving into what they can do. What are some helpful skills, keeping in mind this high prevalence of trauma exposure of the kids they're working with? So helping them recognize potentially triggering events that may happen on the unit, as well as behavioral management techniques such as labeled praise, commands, selective attention, reinforcement, and things of that nature. And we also felt like this would be good to give them opportunities to share their experiences administering these new trauma screening items, and also to get more information on what are next steps that their research can do that would be beneficial to them. And then moving forward, our next step is to disseminate these results to the medical director, as well as the administration, to see how we can make more of a systematic organizational change. If I can go to the next slide. So there have definitely been some difficulties, and that's one reason why I haven't had the opportunity to provide the training yet. One huge one has been staff turnover. So the person who is in charge of, organizing these trainings and in charge of nursing trainings in particular, recently just moved positions. So they're working on hiring a new person. So there is definitely some ambiguity in terms of who now is in charge of that and how to go about setting up that training and organizing it so that we can get as many nursing staff as possible. There's also been some difficulties in figuring out who to disseminate the results to in order to make an organizational change or impact, knowing who has the power in the organization, who to communicate those results to, and then also communicating that the results are really for them, for an internal quality improvement, rather than just having them viewing this as a project that I'm doing for school, really trying to put it more on them in terms of what they would like to do with the results and how they can use it for their purposes. And then I'll go to my last slide. Some things that I've found really helpful have definitely been the support of my policy mentor, because he's had a lot of experience in this and communicating more organizational or community-based research. It's been very helpful. The organization as a whole is very open to research. They definitely don't necessarily know what to do with it or what the next steps are, but they're very open to getting in new research, which has been very helpful. And then overall, the nursing staff's interest in helping with research and becoming involved has been really integral throughout the process. And I can move to my question slides if anybody has any now.
Yes, great. Thank you so much, Stephanie, for walking us through that. Again, yeah, if anybody has any questions, feel free to type them into the questions box. We'll address them now if any pop up, and then as well at the end of all the presentations if any pop up. But again, here's her contact information if you would like to reach out to Stephanie about any of the work she's doing. Thanks again, Stephanie. And now we are going to move on to Aditi. And Aditi Srivastav is from cohort 7. She's the Research and Community Impact Manager at the Children's Trust of South Carolina, where she leads all research efforts. Aditi leads the South Carolina Adverse Childhood Experiences Initiative and Kids Count South Carolina, in which she focuses on research translation and dissemination, facilitating community engagement and training. Aditi greatly focuses on the dissemination of her research as she framed her dissertation on it, and she recently did a webinar about communicating health information. So Aditi, thank you so much for presenting, and take it away.
Yeah, no problem. All right, so as Mickey mentioned, I'll be talking a little bit about my dissertation work, which you can see the very long academic title here, which will be very relevant later in my presentation. But generally, I'll talk a little bit about the study, which was conducted with legislators, with the intent being that not only would it further our understanding of policy and programmatic approaches to prevent adverse childhood experiences, but also be able to really have some practical recommendations for people that are doing the work in the community. So I'll talk about some lessons learned in terms of disseminating research to the legislators that participated, as well as the community. Next slide. So the purpose of the study was really to understand, again, barriers and opportunities for policies and program creation, as well as implementation around ACEs, generally speaking. And it utilized the perspectives of state legislators, so current elected officials, to build insight on what advocacy strategies would really work. And then, of course, it also had a focus on understanding the best ways to communicate research, whether it's about ACEs or any other child health or child well-being related topic, as well as understanding their opinions in terms of how they use data to make decisions, and whether or not the formats in which we typically think about disseminating research is actually helpful. So next slide. Here are some key takeaways from that. So first and foremost, some of the tips that came out of the legislators that participated, and I should note that this was a qualitative study with 24 state legislators, and they gave me, on average, 55 minutes of their time, which is really rare considering how many different interests they have to kind of know about. And I'm happy to talk offline about why I feel like that happened. But these were some of the kind of key themes that came up. The first thing is, anytime you're doing any sort of dissemination with legislators, is you have to break it down. So when we use terms like social determinants or systemic inequities or even, maltreatment, it may not necessarily be something that a legislator who is expected to be a mini expert on several issues will understand. So break it down into something that's easy and makes the issue less complex and easier to kind of access in their kind of wide range of information that's in their brain. Similar to that, use words that are relatable. So while words that we typically use make sense in our academic world, in the real world, one of the recommendations is try to stay at an 8th grade reading level because that's what makes it easy to understand. Another kind of thing that came up in terms of our interviews was always present stories with data. So while there was a recognition that research and data is so important, you have to humanize the problem and make sure that there is something that can contextualize the 1 to 2 key pieces of data that you are presenting. And 1 to 2 is really hard because we typically have lots of data in our research and our studies, but really take the time to pick out what you want to focus on. The fourth kind of takeaway was relationships over reports, and this really speaks to, yes, briefs, white papers, data profiles, journal articles, et cetera, were identified as being helpful. At the end of the day, it was the relationship that mattered. So if I had come in and they did not have a pre-existing relationship with me and I handed them my research, most of them said I would not read it. And so really taking the time to build credibility and then looking at ways in which to make research easily accessible is really, really important. One other thing that came up here is while a lot of us sit in academic institutions, keep in mind that a lot of community folks and people that you want to disseminate your research with don't have access to peer-reviewed publications. So if there's one thing that you take from my presentation is that peer-reviewed publications is not dissemination when it comes to community. I actually don't have access to my own published peer-reviewed publications, and I have to often ask a research assistant at the university or a dissertation professor to get access to it because it's so expensive. And so really thinking about ways in which we can disseminate beyond that peer-reviewed is especially important. And then the other two kind of key takeaways when you're framing your research is keep in mind political values, right? So common political value for maybe Democrats is it takes a village. It takes us all kind of rallying around a child to make sure that they're doing well. Whereas for Republicans, it might be more every child should have the opportunity to succeed, but it is the responsibility of their family to make sure that they have these opportunities. And so research really provides us an opportunity to be nonpartisan and kind of use both those types of framings to really make an objective kind of recommendation as opposed to advocacy persuasion. And then finally, more of an advocacy takeaway was highlight small wins along the way. So we know that complex issues like child maltreatment will take a lot of time, but looking for kind of results that speak to those small wins is especially important. So next slide. So as I was thinking about what I should disseminate, because obviously those are just some of many takeaways that came from the study, I started to think about the metaphor of a bite, snack, or meal. And this was something that I learned in a data workshop. And so as I'm focusing on working more with the community, one of the best pieces of advice I got was most people just want a bite when it comes to research. They just want the key finding, that one piece of information that really highlights and summarizes your results, and that's it. They're really not interested in the nitty-gritty because it's not necessarily going to be helpful to them. And so oftentimes what we think about, what we value is the full meal, right? And so that's that peer-reviewed publication, going through the methods, the theoretical foundations, et cetera. And that's really great for our peers and our colleagues in the same field. But for the average community person, it's probably too much information, and often the meaning gets lost. And then right in the middle is that snack. And so that snack is really giving those kind of high-level findings, but providing enough context that someone can do something about it. So I would probably use a bite of information if I was doing some advocacy work in person, just to kind of get their attention. The snack would really be those briefs or one-pagers, and then the meal I really see as kind of that peer-reviewed publication, in-depth research brief, etc. So next slide. So thinking about disseminating kind of the key findings of this research, I knew that I wanted it to be geared towards the policymakers that participated, as well as other policymakers that may be interested in this work, and our community advocates, our partners. And so I knew that I wanted to do something more along the lines of the snack, because I also knew that I was in the process of putting together a peer-reviewed publication on all of the results. And one of the reasons why I needed to do this was, one, because I promised that I would give them results as a part of participating, since they were not able to take necessarily an incentive being a public official. And two, because one of the major drivers of this research was to be able to develop practical policy recommendations. And so I worked closely with our communications team to develop the product I'll show you. It was both online and print, and most importantly, I delivered it in person to all the legislators that participated and left them extra copies to share with their colleagues. If you don't have access to some of these tools, such as communications teams, you can obviously always work with students or nonprofits in your community that would really be, I think, interested in helping disseminate some of the research that you do. Next slide. So my tip to you when developing a brief that's going to go out is make it a simple title and lots of white space. So you might remember that my original slide had a very long title, and that was my academic title for the peer-reviewed publication. For the actual brief, it was just a very straightforward, this is what it is, and I had lots of white space. No need to fill it with words. Next slide. It's also important to visualize your data. So you could see here that we made it sure that we illustrated kind of the key demographics in a way that you could just look at it very quickly and have an understanding of what things look like. For example, when I had first given this data to the communications team, I had decimals in there, and they're like, what's the fraction of a person? It doesn't matter. You need to round it out and make it clear that you know what the majority was, the minority. So data visualization is really important. Next slide. And then perhaps most important is that you should always, always, always lead with your results. And you can see here that the majority of the brief, which was only about 3 pages, focused on the key results and quotations that supported it. If they wanted to know more information about the background or know what ACEs are or know about the methodology, they could always contact me. But most legislators and community people just want to know what the bottom line is. And so that's kind of reverse when you think about our peer-reviewed publications. Next slide. And then finally, really thinking about ways in which to get the word out. So in my case, I worked a lot with bloggers, as well as using social media as a tool. So you could see here that ACEs Connection, which is a large national blog dedicated to ACEs, did coverage on it. And they're always looking for information to disseminate. So feel free to kind of cold call and get it out there. And then my agency, as well as some of the other professional organizations I'm involved in, help disseminate it as well. Oftentimes, you just have to take that first step, and they're more than happy to get it out for you. Next slide. And then I have the link to the study report as well as the peer-reviewed publication citation here. I know that was a very brief overview, but definitely happy to talk more about what it entailed. And I'll pass it back to Mickey.
Great, thank you so much, Aditi. Yeah, that's great. So we have one more presenter. And again, if you have any questions for Aditi or any of the other presenters so far, feel free to type them into the box, and we'll get to them at the end of the 4th presentation. So the next presenter is Lindsay Zajac, and Lindsay actually is unable to be with us in person today to present, so she recorded her findings. So after I introduce her, I'm going to switch to 2 different recordings. One is her dissemination piece, and one is her presentation of her learning. So bear with me with that technical transition soon. But before we get to that, I want to introduce Lindsay. She's a cohort 7 fellow, and she's a doctoral candidate in the clinical science program at the University of Delaware, and she is currently completing her clinical internship at the DuPont Hospital for Children in Wilmington, Delaware. Her primary research interests focus on the evaluation of parenting interventions and understanding how adversity, attachment, and parenting in infancy impact child development, particularly peer relations. Okay, great. So now I'm going to transition to two different videos. So you will have to control the volume of these videos on your own device. So whether you're on a computer or a phone at this time, please make sure that you have your volume set accordingly. So here we go. First, I will show her her dissemination piece, and then we'll go to her presentation. Okay, great. So we got through the technical challenges with watching Lindsay's presentation and her video or animated short. So again, I'm just going to thank Lindsay for her time on that, and we're bummed that she couldn't be with us in person, but happy that she was able to record her information, because her animated short was a really great example of different ways for dissemination. So that brings us to the end of the presentations by each of the fellows. Thank you to everyone for taking the time to present. And I now want to open it up to questions that people have. We've already had a couple come in, but I'm going to also give all the participants some time to type in their questions to the question box on the side of their screen. Oops, okay. And again, here's the contact information for all of the fellows who presented if you want to get in touch with them. And we will also be following up with this information as well after the webinar. But we did have a question come in. Leah, this is more of an ask from our fellows to, if you could please disseminate the link to the op-ed, and I can also do that as well at the end of the webinar as well. But we had a request for you to send that, and I just wanted to also leave you the opportunity to kind of give any final thoughts on your op-ed process, or any other strategies or thoughts that you have about that. And you may need to unmute yourself if you haven't already.
Let's see, can you hear me now?
Yes, we can.
Okay, perfect. Yeah, thank you for the opportunity to just say a couple more things. I'd be happy to share the link with anybody who's interested. You might be able to track it down online as well, given the title on there. But I just wanted to mention, I'm not entirely sure how the editor found me online to reach out, but it's quite possible that it was through the Doris Duke website. So I just wanted to put a plug in for updating your web presence and ensuring to, keep all of that information current about your interests, because I know that there were a few other Doris Duke Fellows as well who ran op-eds in that same series. So it's quite possible that's how they tracked us down.
Couldn't have said it better myself, Leah. That's excellent advice about keeping your Doris Duke profile up to date. And if anybody has any updates, feel free to email me, Nikki, anytime. And again, yeah, thanks for sharing that information, Leah. So we also had just a general request come through asking to share these slides at the end of the presentation. And so yeah, we'll disseminate this recording and the slides as well to everyone, so that you have the opportunity to review them at any time. But then we also had a question come in for Aditi. I'm actually going to turn it over to Kayla Byers, who's in the room with me, to take it away.
Yeah, so the question is about the bite versus the full meal, and I think, Aditi, one of the things that you mentioned was how unusual it is to be able to get a large amount of time with legislators and policymakers. And so I think often when we have the opportunity to share that information, we're very tempted to give the full meal. It's embedded in our training, but also this might be your one chance to give them everything you think that they need in order to make the difference you want to see. And so I'm wondering if you have some suggestions or tips around the best ways to engage with maybe multiple bites in order to make sure that you're getting all the key points across without giving them the full meal, or to build up to being able to provide that more robust information.
Yes, I think that what you just said about building up to that is your goal. I think it is very natural to want to give everything as much as you can in a short period of time. But the reality is, for example, in South Carolina, and this is actually pretty common across a lot of state legislatures, your legislators are part-time. There's 170 of them. They are in session for 4 months. And frankly, there are issues that have a lot more money behind them. They have strategic lobbyists up there every day, and you always typically have fires to put out. And so unfortunately, a lot of issues that we all are interested in are seen kind of as a, yes, we care about this. And there was a quote that I remember where they said, yeah, prevention is great, and that's something I care about, but it's not going to get me to pass a bill. And so really, for the first couple of visits, trying to keep it as narrow as possible, and that is really hard because we're used to kind of, you know, making one idea an entire paragraph instead of a sentence when it comes to, you know, academic writing is so important. And I do think that over time, so in my case, after I was able to take off the researcher hat from doing this study, there were legislators and their staff that contacted me to learn just more about ACEs and learn about what other states are doing, and that provided me that opportunity to really have a larger conversation. But when you're just initially starting out and trying to get your cause out there, I very much recommend sticking to that bite as because they will contact you. And if it's not the legislators themselves, it'll be their staff who are actually helping make a lot of those legislative decisions. So I guess I'd recommend try your very hardest not to give everything at once, because if you can kind of get their interest and their trust, they will come back to you to ask for more.
Great, thank you, Aditi, for explaining more on that. Great, yeah, and then one more question came through for Stephanie. So it's kind of two different questions. The first one was about you know, other thoughts or considerations you made for different dissemination options and how you settled on this one, and then just any other general thoughts on your dissemination efforts.
Yeah, absolutely. So one of the reasons that we settled on or starting with the disseminating to nursing and staff, one is that we saw the purpose of this project really being an internal quality improvement process. So we wanted to start with staff, particularly the staff that are really spending the most time with the kids, which is the nursing staff. And then just anecdotally, while working there, I have seen and heard a lot of nurses voicing concerns about just not knowing how to really deal with the kids on the unit. So this felt like a unique opportunity to share with them the results of what they had helped us gather, but also give back to them in terms of what is information that we can share on how knowing about the trauma prevalence of the kids on the unit can shape how they interact with the kids and what they can do to improve their interactions with the kids. Me and my policy mentor have also talked about expanding this to more of like a practice-focused journal, just in terms of talking about the process of getting this project started, some of the challenges that we faced, as well as what we have found helpful. So that's something that we're kind of, it's still kind of in the works and still considering, but definitely wanting to start with giving the results back to the organization and trying to see if the organization is able to make changes to improve their screening process more systematically.
Okay, great. Thank you, Stephanie. Okay, so those are all the questions that have come in now, but I just want to give the opportunity for Leah, Stephanie, and Aditi, if you have any last thoughts or comments or anything, to give you the opportunity now to share. Okay.
I'd be happy to.
Go ahead.
Hey, this is Leah. I just wanted to quickly mention also, sometimes you can reach out to other fellows or just other colleagues in your area and engage in some of these kind of innovative dissemination strategies as a team. I know that for one of our small group projects for cohort 4, we developed a blog disseminating some of our research findings, and it was a really enjoyable experience, particularly in a team setting. So just something else to think about in terms of opportunities.
Great, thank you, Leah. Aditi or Stephanie, if any of you have any last minute thoughts, feel free to share.
So I would just say that while sometimes the work can be intimidating in terms of kind of moving us out of your comfort zone and how maybe necessarily our training has been or the process has been. Keep in mind that there's no perfect way of doing it, and really taking the opportunity to kind of learn as you go is totally okay. And recognizing that you are an expert, right? And coming in with that sort of confidence, you can really make a difference, and people want to hear what you have to say. So, it's okay if it's not this exact process that we're used to typically in academia. It's a little bit messy in terms of community, and that's okay.
Thank you,
I would say,
yeah, go ahead, Stephanie.
Sorry, I was just going to say for last minute thoughts, I was thinking the one thing that's been really helpful for me is just seeking out mentorship, whether that be my policy mentor or even my clinical supervisor or some of the administrative staff have been really helpful, even if they haven't known the answers to my questions or the best way to go about disseminating things. Just having someone kind of in your court to bounce ideas off of has been really helpful.
Yeah, definitely. Thanks to all of you for sharing those last minute thoughts, and also just taking the time out of your day, and everybody who joined to watch this presentation. I know it's a busy time of year, so thank you all for making time for this. And again, we will disseminate this recording and the slides, and feel free to reach out to me, Leanne, or anybody on the presentation today with any further questions. But on that note, we will end now, and thank you all, and have a wonderful rest of your day. All right, goodbye.
Bye.